Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwonka. First, the highlights. Nigeria Center for Disease Control logs 58 new COVID-19 infections in the last 24 hours as global caseload surpasses 400 million. National Primary Healthcare Development Agency pays advocacy visit to the governor of Sokoto State with focus on COVID-19 vaccination and other primary healthcare services. And Canadian authorities scramble to end anti-vaccine mandates protests. The World Health Organization, WHO, says the 500,000 COVID-19 deaths recorded since the Omicron variant was discovered is beyond tragic. Abdi Mohammed, WHO incident manager, said 130 million cases and 500,000 deaths have been recorded globally since Omicron was declared a variant of concern in late November. Now, Mohammed told a live audience on the health body's social media channels that in the age of effective vaccines, 500,000 people dying, it's really something. While everyone was saying Omicron is milder, they missed the point that 500,000 people have died since this was detected. It's beyond tragic. Well, here's more on the pandemic update.
58 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 6 states and the FCT. That's an increase from figures reported earlier. Lagos accounted for the highest number of cases with 35 infections. The FCT had 9, Edo 5, Delta 4, Kano and Rivers logged 2 cases each, while Kaduna registered 1 case. The total confirmed cases in Nigeria now stand at 253,838. The report also includes a backlog of cases from Lagos and the FCT, as well as 0 cases from Ekiti, Ogun, Osun, Ondo, Oyo, Plateau, and Sokoto states. 67 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,211. Over 16 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 6.4 million of the population have been fully vaccinated. In Africa, over 10.9 million persons have tested positive, while over 242,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 401 million, while deaths are now beyond 5.7 million.
The Executive Secretary of the National Primary Healthcare Development Agency, Dr. Faisal Schreib, says over 500,000 persons are expected to be vaccinated against COVID-19 in the country on a daily basis. Mr. Schreiber disclosed this in Sokoto, where he led a team on a visit aimed at improving the vaccination figures and to change the negative narrative through engagement of stakeholders on ways to solve the challenges of mass public acceptance of the COVID-19 vaccines. He says 15,000 persons are expected to be vaccinated against COVID-19 daily in Sokoto based on the national projection target set out in the COVID-19 vaccination nationwide program.
Despite these huge investments in the healthcare sector, we are not seeing a commensurate translation of the investments, of the leadership, of the capabilities in the outcomes. My colleagues have talked about the low routine immunization coverage, the suboptimal COVID-19 vaccination rates, the high maternal and under 5 mortality. We continue to see outbreaks of the circulating mutant polio viruses. These do not match the capabilities that we know exist in Sokoto State. So our visit is to come and sit and listen to the people of Sokoto State, the technical team, the operational arm of the government, to understand how the federal government can support Sokoto State citizens.
On his part, Governor Mino Tambawa is calling for more support in strengthening the state's healthcare services. He's also asking residents to ensure that they make themselves available for the ongoing vaccination exercise.
Truly, we have a lot more to do in strengthening our systems, more to do in training and retraining and expansion of primary health care services to our good people. On this note, I once again appeal for more support from your end to our teams and to our government and to our people so that we can address the challenges of low immunization rate, the challenges of low COVID-19 vaccination, maternal mortality, and of course, all the associated challenges.
The International Air Transport Association, IATA, has urged governments to accelerate relaxation of travel restrictions as COVID-19 continues to evolve from the pandemic to endemic stage. IATA called for removing all travel barriers, easing of travel restrictions in recognition that travelers pose no greater risk for COVID-19 spread than already exists in the general population. Well, joining us to talk more about that, Mr. Bankole Bernard, his immediate past president of the National Association of Nigeria Travel Agencies, NANTA. Thank you for joining us on the program.
Good evening.
Good evening. First, it's been over 2 years since the pandemic started. The COVID-19 brought travel and tourism to a near standstill at the beginning. And then travel began again, and it's beginning for some who shut their borders for almost 2 years. How would you describe this year, 2022, from the previous years, 2020, 2021?
Well, the good thing is that we've seen the worst of COVID-19, and we're beginning to see light at the end of the tunnel. Every government around the world have come to one realization that at this particular point in time, this year is the best time to rebuild the economy. We can no longer close our borders, and that's the truth. And if you can see from what the Western world have been doing, they've been making moves towards opening their borders, reawakening their economy, and live with COVID-19 because it has come to stay. Whether we have COVID-19 repeat itself in different waves, the fourth wave, the fifth wave, it's not going to change anything. It has come to stay with us, and it's high time we accept it, that this particular pandemic has become an epidemic, and we must live with it. We are so anxious in the industry to make sure that people are able to move from one point to another, and they are not restricted just because of COVID. And as you can see, with the introduction of the vaccine, we've seen some other countries coming out to say, once you've been vaccinated, you can move around, you're free to travel into their country. And I think that's what Nigerian government too should look into, so that we can wake the economy. Every economy around the world has been battered by the fact that COVID crippled most of the economy, and around the world, everything is being turned around, and we cannot be exempted from that.
But even though IATA is urging relaxation of travel restrictions, suggesting COVID is moving from pandemic to endemic, on the other hand, WHO is saying, for those saying Omicron is milder, it's killed 500,000 people already.
Well, unfortunately, this is a pandemic that, like I said, has come to stay, and the worst of it, we've seen it. Are we still going to be gnashing our teeth over the fact that we've lost lives? We have to move forward. And moving forward will be the fact that the government should strengthen the vaccination program, ensure that as many people as possible are vaccinated. Once they're vaccinated, then I think people will be able to start living their normal life. We can't live in isolation. It's just not possible. The economy needs to wake up. And you can see all around the world. England, UK, for instance, by 11th of this month, there will be no more restriction on people, COVID tests on people coming into their country. That is being done on purpose. They're trying to attract people, tourists, investors back into the economy so that they can benefit and grow the economy rather than leave the economy the way it is. We can't do that. It's just not possible.
So in terms of our isolation, our current quarantine isolation days, I know Nigeria is still retaining 14 days. We have countries that are doing 10 days and some 7. Do you think we need to review that as steps towards what you've painted we need to do?
Certainly, we have to review it. Certainly. UK used to have 7 days, 2 days quarantine. Not anymore. By 11th of this month, once you're vaccinated, you need not to be quarantined for any reason. Not only that, you equally need not to do COVID test anymore. These are ways of getting people back into the country to do what they're supposed to do. So it's something we just need to look into. Like I said, there are ways to get this done. How well have we enlightened our people about the vaccination? How many people in the entire population of over 200 million people have been vaccinated? Once we can get as many people as possible vaccinated, I think the economy can roll.
Mr. Bernard, let me ask you a final question before we go on break. And this question is, in terms of the future that you see, what do you think travel would look like? Many people are already complaining. Going to Ghana, you have to have over 500,000 now with the insurance, COVID test. So will it be expensive? What do you see? Briefly.
Well, as you're aware, Africa is always the last to wake up in anything. And the earlier the African countries wake up, the better for them. Otherwise, we'll see flow of traffic to the Western world where things are done and are done properly. So if you continue to put strong barriers, it's going to affect you and affect the economy. So the earlier we wake up, the better. If Ghana is not going to open its border or is putting too much restriction that is leading to higher cost of traveling, people will move to other destinations. It's just very simple. People are always ready to move. So it depends on whether you're ready to open your economy and reduce the cost and the burden on travelers. That will determine what you will get. And if you're not going to do that, then move elsewhere. UAE, they've opened their economy again. Nigerians and other African countries can come in, right? UK is saying you can come in. So if the African countries are not ready, off luck. They're just not going to partake in the cake.
Mr. Bankole Bernard is the immediate past president, National Association of Nigeria Travel Agencies. Nanta, many thanks for joining us on the program.
Thank you very much.
We have more on the COVID-19 pandemic update when we return. Please stay with us. With the onset of COVID-19, healthcare delivery organizations around the world were collectively faced with one primary challenge: how to effectively deliver quality healthcare to all patients while protecting the well-being of non-COVID-19 patients and the healthcare workforce. Evercare Hospital Lekki is beating the odds to provide healthcare standards of the multi-specialty and tertiary care driven by innovation in ensuring quality healthcare delivery.
Within a period of 1 month, Evercare Hospital Lekki has recorded 3 groundbreaking moments: open heart surgeries, spine surgeries, and an advanced first-of-its-kind pediatric surgery were all carried out at this state-of-the-art facility. The hospital's way of informing the public that they are more than capable to provide quality and accessible health care to patients.
Another milestone for us is the commencement of spine surgeries in the facility, with specialties in interventional spinal injections, decompression, and instrumental fusion surgeries. We have also recently carried out an advanced first-of-its-kind pediatric surgery. This was the first laparoscopic thoracoscopic repair of esophageal atresia. This was done on a 3-day-old infant with a first-of-its-kind technique with this surgery in Nigeria and West Africa.
In our country and actually in West Africa, we usually make incisions on the chest wall of these patients, and we access the esophagus to repair the atresia. This is very devastating for the baby who is newly born and cannot swallow his or her own saliva. This will lead to a division of the muscles of the chest, after which this patient will have a turbulent post-operative period usually, and when they make it, they tend to have chest wall deformities. However, with minimal access, which we did at Evercare, there is little or no telltale signs that this patient had surgery.
The 165-bed multi-specialty tertiary care private hospital is now fully equipped with modern infrastructure and surgical equipment.
We started last year with surgeries which was done on the lumbar spine for patients who develop infection in the spine, which causes instability of the spine and severe pain, preventing them from ambulation. Another case which was done is a very interesting case when the patient came with a difficulty of walking and using the hands, cannot feed herself, cannot hold anything in her hands. We came and removed whole vertebra in a cervical spine, which was fully filled with cancerous cells. Then we took the bone from the patient pelvis bone and inserted in the cervical spine and put a plate and screws to hold the spine together. The surgery went extremely well. The patient was discharged from the hospital in 1 week.
There is also assurance from the medical team to provide exceptional care for patients.
We have all the infrastructure which is required for the care in ICU. We have that. We have trained our staff to look after these patients, and the good results will only come with full teamwork. We have excellent physiotherapy department.
One of the greatest challenges patients have about cardiac surgery is they've heard that, look, this is a major surgery and people die, and people can die from it. Everywhere in the world, that fear is always there because you have to be connected to a bypass machine. So the bypass machine takes over the function of the heart and the lungs. So we stop the heart, stop the lungs, and the bypass does everything, and then we can now work on the heart. And when we finish, we start the heart again, return the function of the heart and the lungs back to the patient. So when I was discussing this with the patient, I remember vividly, this man, he broke down and started crying. And the wife was consoling him. He said if he dies, he does not know what the wife would do because the wife can't live without him. After the surgery, 5 days later, I think he was discharged. And yesterday we still saw him. He's doing well. He's gone back to work. The beauty of this is that people can return to their normal life after the surgeries.
With the clinical milestones achieved by Evercare Hospital Lekki within the short period of its commissioning, the healthcare facility is on its way to transforming the traditional model of treatment by ensuring quality improvement.
And from Lekki, we head to Ghana, where vaccination is ongoing as the country has vaccinated over 10 million with the COVID-19 vaccine doses administered. Joining us to talk about the situation there, Dr. Samuel Ofori-Ayekum is the medical practitioner. He joins us from Accra. Good to see you. Thank you for joining us.
Good to see you, and thanks for having me.
Thank you. So according to the World Health Organization, Africa, deaths, hospitalizations are lower than previous waves. What's the situation in Ghana?
Well, the data from the WHO is actually true, and it reflects the situation on the ground as we have fewer hospitalizations this time around, especially with the Omicron variant. The reason being that most of the symptoms are quite mild and limited only to the upper respiratory system, as opposed to the previous Delta variants and other ones. So there is actually less hospitalizations this time, yes.
So can we say that, you know, the wave or the cases, infections being witnessed are more Omicron than Delta, or both?
According to the anecdotal evidence we have as of now, it is more Omicron than Delta. But I cannot say conclusively because we are not doing a lot of mass testing as it was done in the early stages of the pandemic. But currently, we only test people who arrive through our ports into the country. And also for internal patients, we only test people who present to the hospital with severe symptoms. But the data tilts more towards the Omicron variant than the Delta.
So for the response, you know, with regards to the government and the healthcare agencies, stakeholders there, what's happening now with the infections that are low? Are you easing restrictions or are they still in place?
A lot of the restrictions has been significantly eased. What is being encouraged is for people to still maintain compliance with the safety protocols, like wearing of masks, social distancing, and all that. But generally, the mood of the people are up, and the fear, let me say, has somehow subsided. So the health authorities are doing well to encourage the people to keep the safety measures on. Yeah.
What about the healthcare workers amongst your colleagues?
Well, the precautions are quite high among healthcare workers because between December and now, a lot of healthcare professionals were infected with the Omicron variant. I was infected as well. So we are somehow on our guard. But like I said, the symptoms were quite mild as compared to the previous ones. And people are kind of more, in quotes, comfortable with this variant than the previous ones because of the mild symptoms. Yeah.
And I take it vaccination is also progressing.
It is. Currently, vaccination is ongoing, and we have assurances from the government and the Ministry of Health that they are doing well to procure more vaccines to be able to vaccinate a lot more of the population, and if possible, provide more booster doses as well.
We appreciate your time. Thank you so much, Dr. Samuel Ofori-Ayekum, medical doctor, joining us from Accra. Thanks.
Always a pleasure. Thanks for having me.
And the situation in Canada leads our global update as police there have arrested some demonstrators in the country's capital, Ottawa, after nearly 2 weeks of a trucker-led anti-vaccine mandate protest. The capital has been under a state of emergency after protesters blocked the city centre with trucks and cars. Police have seized thousands of litres of fuel in recent days and say that up to 25% of the vehicles contain children who could be at risk during operations. Here's more of the global update.
Canadian authorities are scrambling to find ways to end the 12-day-long occupation of the national capital's downtown, hoping a combination of criminal charges, traffic tickets, and the prospect of losing access to fuel will end the blockades. Police say the number of protesters in Ottawa against public health measures to fight COVID-19 is dropping in the face of tougher policing and a 10-day injunction. Meanwhile, inspired by protesters in Canada, demonstrators have gathered in southern France for what they say will be a freedom convoy that will converge on Paris and Brussels to demand an end to COVID-19 restrictions. About 200 protesters assembled in a parking lot in Nice and France's Mediterranean coast, with many displaying Canadian flags in a nod to the truckers in Canada who are protesting their government's COVID-19 restrictions. In New Zealand, hundreds of people protesting against vaccine mandates and pandemic restrictions have blocked streets outside the parliament for a second day. A heavy police line was deployed in front of the parliament building to stop protesters from entering. According to local authorities, 3 arrests were made as protesters tried to break through a country of 5 million people. New Zealand has had about 18,000 confirmed COVID-19 cases so far and 53 deaths. Officials at the WHO's Eastern Mediterranean Regional Office says Middle Eastern countries have seen a rise in coronavirus infections in the last 6 weeks because of low vaccination rates. Reported COVID-19 cases have risen to a daily average of 110,000 in the past 6 weeks, while average daily deaths rose to 345 in the last 3 weeks. Over the past 24 hours, Hong Kong's daily COVID-19 infections nearly doubled to a record 1,161 as the global financial hub battles a rapid surge that is shaping as the biggest test yet of its dynamic zero policy. The city has reported close to 4,000 infections over the past 2 weeks, up from just 2 in December, taking its tally to more than 17,000 since the outbreak began in 2020, with 215 deaths, although the figures are lower than other major cities in the world.
For more updates and a better understanding of the pandemic, take a look at our website. It's channelcv.com. It also has other stories, breaking news at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.